The next thing we're going to do is we're going to learn how to change a central line when we have to do a central line dressing change for our patients in the hospital. What you're going to need is always gather your supplies first. The supplies that you're going to need in order to change the central line is a central line dressing kit from your hospital supply. You'll also need to get what's called a Biopatch. A Biopatch is a special patch that we put around the insertion site of our central line. This nice little Biopatch is put around this insertion site of the central line. And what it does is it's actually saturated with antimicrobial agent, and that provides some antibiotic broad range coverage so that if we had any type of loose or opening, it would reduce the risk of our patients getting infections. So we'll also need one of these when we're putting that on when we're doing our dressing change for our patients. What I normally do is I get all my supplies ready. I get a normal pair of gloves, and I first will open up my dressing kit because I need to get the supplied mask that's inside. So I'll go ahead and get my supplied masks inside, and then I'll close it back up. The next thing I do is there's two masks. There's one for me and there's also one for the patient. And the reason for this is that I am trying to reduce the patient getting an infection from myself if I were to cough on it while I was changing the dressing with it being exposed to the open air. Or if the patient were to cough, we don't want them to get the line infected as well if they were to cough also. There's a darker side and a lighter side. I usually will just put it on the lighter. It doesn't matter, but there's a bar on the top that you want to put at the top of your nose when you're putting your mask on. So I'll put that on, and then you'll ask your patient to put their mask on. If your patient doesn't want to put the mask on, it's okay for them not to wear the mask because they may have some claustrophobia issues, but you make sure that your patient looks to the side when you're changing the dressing so that they don't cough on it by accident and so on and so forth. So if they don't want to put the mask on, then just let them know that you want them to turn their head to the side. Next, I'm going to go ahead and put on my regular pair of gloves. You can just use regular gloves to take off the dressing. The dressing usually is changed per the hospital policy, and most hospital systems would like them changed once a week. We don't want to change them too often because that only increases the risk of infection. The other time you would change it, unless it were sooner than a week, is say you come in and your dressing's like loose, like this one is. If your dressing is loose in any way or air can get into the actual the site, you want to make sure that you're going to be changing the dressing that day as well. So for this one, I normally will work from the outside in when I'm doing my dressing change, and then I always hold the skin taut and then pull quickly when I am doing the dressing. And then I work always, always, always from the inside out, holding down on the skin and then pulling quickly. Holding down on the skin, pulling quickly, and then outside in. All right. And notice I still haven't even gotten to the insertion site because I like to work from the outside in. And then next, I like to work from the bottom part now up as I hold my actual lumen so that it doesn't get pulled out by accident. And then I slowly pull up until the whole dressing is off. Okay, so now it's exposed, and now this is where the procedure becomes a sterile procedure. So I'm going to take off these regular gloves, and I'm going to open up my kit. I'm going to open up my kit and get out my gloves and don my pair of gloves. I'm going to put on my first sterile glove, and then my second sterile glove. And sometimes these don't go on too easily. Just go ahead and continue to work with it until it goes on correctly. And now I can go ahead and touch whatever I want to touch in my dressing like I want to because my hands are sterile, okay? This first thing is the actual cover that you would use to cover your patient, it usually is put shiny side up. There's a shiny side and then there's a dull side. Make sure you put it shiny side up. And then I normally just put it over the top of my patient's clothing or whatever, if they have clothing on, so that I don't, you know, contaminate the area, all right? And the patient's usually lying down, so then that will go kind of up like that, all right? The next supply that I use will be the chlorhexidine swab. This swab is like alcohol, but better. It's called chlorhexidine, and it's a ChloraPrep. All you do is you just crack it, and then you squeeze it until this little area, the pad, becomes saturated with the actual chlorhexidine liquid. There are times where you'll have like crusty things, bleeding, stuff like that around the insertion site. You can use these little bitty forceps to kind of pull those things off. Or if you want to lift up those little catheter sections, you can use those to lift those up as well. But really all you're going to be using is this ChloraPrep. And then you always want to make sure you're working from the inside out, And per the Oncology Nursing Society's Vascular Access Guidelines, you want to make sure that you're scrubbing vigorously from the center, working your way out. And I'm going to go ahead and move this drape so that you can actually see the procedure being done. All right, so after about 5 or 10 seconds, I start moving out. Never, ever, ever going back to the area that I've already cleaned. And I'm continually just kind of in a scrubbing motion back and forth, getting my area nice and clean for my patient. And notice I haven't really moved this hand because I don't want to touch anything to contaminate it. And then you're usually working in about a 2 to 3 inch diameter on cleaning the area. All right. Okay, so now that's nice and clean. You allow that area to air dry. Do not go and like do it with your hand, blow on it, nothing like that. Allow it to air dry completely before you start putting the dressing on. All right. And then there comes a time where you forget to put your Biopatch into your sterile field. So sometimes you'll have to ask a nurse to come and do that for you, which I'm gonna have to ask a nurse to come do that for me because I forgot to do that. So what I'm going to do is I'm gonna ask my nurse to come and do that, and she's gonna come and put that on my sterile field for me. Here she comes, she's doing it. She'll put that on my sterile field so that I can go ahead and do my Biopatch. All right, so my Biopatch has 2 sides, guys. It has 2 sides. It has a blue side, and then it has a white side, all right? And then there's a slit right in the middle of it, okay? Also, some of the Biopatches also have typed on there, this side up. Always make sure the blue side is up to the sky, all right? Now that my patient's skin is fully dried, I'm going to just put this Biopatch on around the insertion site of my catheter. All right, around the insertion site of my catheter. And then I'm going to put, lastly, the dressing on. Make sure you're holding the dressing at the very edges, because if you don't hold it at the edges, sometimes you'll get your glove stuck on it and then you'll have to get a new dressing. The point of this is that you can either put it this way, this way, this way. It doesn't matter the direction of the actual dressing itself. You just need to make sure that the center of this dressing is at the center point of the insertion site of the catheter. And then when you put this on, ask your patient to look to the side, because then that opens up the area and it reduces the risk of this dressing coming loose when they begin to move their neck around. All right, so what I usually do is I kind of put my thumb right in the middle, because then that kind of guides me in the way I need to go. And then I let it kind of sit there, and then I let it drop. And then that way it kind of goes nice and neat onto the patient's skin. All right? And this isn't gonna stay. And then you just peel this off. Peel this off. All right, that gets peeled off. And the dressing is nice and secure, all right? Nice and secure. And then you will lastly put your initials, the date, and you don't need the gauge, you just need your initials and the date that you did your dressing change. And then you will put this anywhere on the actual dressing so that they know when it was time to be changed again, all right? All right, and that is how we do a dressing change.